fossa. Let's look at the region known as the cubital fossa. The cubital fossa, the other name is known as the elbow pit. It is a triangular depression on the anterior aspect of the elbow joint. So that triangular depression on the anterior aspect of the elbow joint is known as the cubital fossa. So this is what I mean. This is known as the cubital fossa, this triangular depression, and it is used for a number of clinical procedures. The cubital fossa contains nerves and blood vessels, but the danger is that those nerves and blood vessels are only covered by skin and superficial fascia. So, on a positive note, those blood vessels can be accessed easily for clinical procedures, but on a negative note, because they are only covered by skin and superficial fascia, they can easily be injured. The cubital fossa has a medial border. This is a lateral border. It has a lateral border. It has a medial border, and it has a superior border. The borders are very important. It has a lateral border, a medial border, and a superior border. And the medial border, you can see, this is the medial border. It is made up of this muscle known as Pronator teres. It is a muscle of the anterior compartment of the forearm. So the medial border is made up of this muscle known as Pronator teres. But I want you to pay attention to this. This Pronator teres has a medial boundary and a lateral boundary. It has a medial boundary and a lateral boundary. So when we say that the Pronator teres forms the medial border, but specifically its lateral boundary is the one which forms the medial border of the cubital fossa. The lateral border is formed by this muscle known as Brachioradialis. Brachioradialis also has a lateral border or lateral boundary and medial boundary. Lateral boundary and medial boundary. So when we say that the lateral border of the cubital fossa is formed by this muscle known as brachioradialis, we are referring to the medial boundary. So it is the medial boundary of the brachioradialis which forms the lateral border of the cubital fossa. The superior border is formed by an imaginary line between the medial epicondyle and lateral epicondyle. An imaginary line, meaning that it does not exist, you imagine it, between the medial epicondyle and lateral epicondyle. So these are the borders of the cubital fossa. This cubital fossa has a floor. The cubital fossa has a floor. The floor of the cubital fossa is made up of the brachialis muscle and the supinator muscle. We have talked about the muscle known as brachialis. It's a muscle of the arm, anterior compartment. So it comes and enters the cubital fossa and forms the floor. So the floor of the cubital fossa is formed by brachialis muscle and supinator muscle, on which the contents lie. So that is the superior border, medial border, lateral border, and the floor is formed by the brachialis muscle and supinator muscle. What do we find on the inside of the cubital fossa? What are the contents of the cubital fossa? The contents of the cubital fossa are named in order. So these are the contents of the cubital fossa. You have the median nerve. From medial to lateral, you have the median nerve. Then you have the brachial artery and its branches. The brachial artery and its branches. Then you have the tendon of biceps brachii as it is going to start on the radial tuberosity. And then you have the radial nerve. So from medial to lateral, you have the median nerve, the brachial artery and its branches, the biceps tendon, and then the radial nerve. These are the contents of the cubital fossa from medial to lateral. You can also name them from lateral to medial as long as they are named in order. What covers these contents? What covers these contents? Remember when I was talking about biceps brachii, I talked about what we call the bicipital aponeurosis. Part of the biceps tendon becomes an aponeurosis and inserts into skin. So this bicipital aponeurosis, as it's going to insert into skin, covers the contents of the cubital fossa, so they are below it. So when we say the roof of the cubital fossa, the roof of the cubital fossa is the bicipital aponeurosis, superficial fascia, and the skin. So they are only covered by the bicipital aponeurosis, superficial fascia, and skin. So any penetrating injury there can easily injure these contents of the cubital fossa. The roof of the cubital fossa, I said, is the bicipital aponeurosis, the subcutaneous tissue, and the skin. Meaning that these structures pass below the roof. As you can see, this is the bicipital aponeurosis. So you can see the blood, the nerves and blood vessels. This is the radial nerve. This is you can see the tendon of biceps brachii. You can see the brachial, artery, and the median nerve. They are passing below the bicipital aponeurosis. So the bicipital aponeurosis, the skin and the subcutaneous fat form the roof of the cubital fossa. So what is the clinical significance of the cubital fossa? When you're measuring blood pressure, the stethoscope is placed above on the surface of the roof of the cubital fossa. When you're measuring blood pressure, the stethoscope is placed on the roof of the cubital fossa, and that stethoscope is going to listen or to enable you to listen or to auscultate the pulsations of the brachial artery. So you can palpate or auscultate. To palpate is to touch and sense. To auscultate is to put a stethoscope and listen to. So they can use it to auscultate the pulsations of the brachial artery because it is only covered by skin and fascia. So you can easily auscultate or palpate the pulsations to measure the blood pressure. They can perform an action known as the action, for example, known as phlebotomy. Phlebotomy refers to puncture of blood vessels. When you look at the roof of the cubital fossa, the roof of the cubital fossa contains veins. And these are the veins which are used for that clinical procedure known as phlebotomy. Phlebotomy is to puncture a blood vessel. For example, they puncture these blood vessels to draw blood for laboratory investigations. They can puncture these blood vessels to insert small tubes known as catheters. So these veins are within the roof. They are not contents. These veins are within the roof of the cubital fossa, and they are used for clinical procedures because they are just below skin, so they are easily accessible. When they are carrying out those clinical procedures like phlebotomy, they do not go to the contents of the cubital fossa. So when someone is handling a cubital fossa and they are trying to insert the needle in a vertical orientation, they are going to go and injure the nerves and blood vessels. They only go below skin, percutaneous, to access the veins of the roof. Those are the veins which you must access when you are doing phlebotomy. But when you go deep, you're going to injure the radial nerve, you're going to injure the median nerve, you're going to injure the brachial artery. So there should not be anyone to tamper with the contents of the cubital fossa, with the exception of a few procedures. The veins which are used are the veins within the roof. The veins within the roof are the ones which are used. So when we look at that clinical procedure known as phlebotomy, that is the puncture of blood vessels. Puncture of blood vessels. For example, they can insert what we call a central catheter and navigate it up through this vein. This vein is known as a basilic vein. It is in the roof of the cubital fossa. So they insert a central catheter within the basilic vein, and then they navigate up until the catheter reaches the axillary vein, and then they take it to the brachiocephalic vein, superior vena cava, until it reaches the right atrium of the heart, and they can inject a contrast medium there to outline maybe the chambers or blood vessels of the heart. This is one of the procedures which is used when they are accessing the veins of the roof of the cubital fossa. Those veins can also be used to draw blood samples. For example, you have this vein which is in the roof of the cubital fossa known as the cephalic vein, and the medial vein is known as the basilic vein, and they are joined together by what you call the median cubital vein. These are the veins within the roof of the cubital fossa: the cephalic vein, the basilic vein, and the median cubital vein. These are the veins that they use to draw blood samples for laboratory investigations. They can also insert their IV lines. For example, if they are going to administer normal saline, like drips, they insert those needles inside these veins. Because they are easily accessible, they are in the roof, and there is no danger of injuring the contents of the cubital fossa. The arrangement of these veins within the roof of the cubital fossa varies amongst individuals. Some individuals have a cephalic vein on the lateral aspect and a basilic vein on the lateral aspect as usual, and they are joined by one oblique median cubital vein. Whereas other individuals have a cephalic vein on the lateral side and the basilic vein on the medial side as usual, but they have a different format of the median cubital vein. There is a tributary which is draining into the cephalic vein known as the median cephalic vein, and another one known as the median basilic vein. So this is the format in some individuals, whereas the other individuals, this is the other format. However, what matters is that these veins are within the roof of the cubital fossa, and they can easily be accessed for laboratory investigations.